Hello, everybody, and welcome to another ultra popular and hopefully ultra helpful Fertility 101 episodes. Today, we're going to learn about family building and fertility preservation options for the transgender community. And we're going to do so with the help of an expert, Dr. Daniel Potter, a reproductive endocrinology and infertility subspecialist and the regional medical director at HRC Fertility in Newport Beach, California. But before we dive into today's topic, I just want to take a second to remind you that we have some resources available for anyone who might want to bring fertility and family building benefits to their employer at progyny.com/talk-to-HR. Most employers that offer family building benefits do so because an employee asked for it. So take advantage of our resources and help bring this life-changing benefit to your employer. Okay, let's dive in with Dr. Potter and learn about some family building options for transgender people.
I mean, the good news is that transgender people have really the same treatment options available to them that cis people do. So, the outlook for them in terms of family building and reproduction is really positive.
Okay, so that's a good place to start. Once you understand that transgender people have the same options as cis people, well, it all gets pretty clear. But let's dive in case by case here, and let's start with fertility preservation and fertility treatment options for transgender women.
For trans women, the fertility preservation and treatment options are really quite simple. It involves freezing sperm, and that sperm could either be obtained through ejaculation, or we can surgically extract it if it's too dysphoric for them to produce a specimen through masturbation. Additionally, there are experimental protocols where they can harvest testicular tissue and freeze it at the time of orchiectomy, if that's part of the transition plan, removal of the testes.
Okay, and what about for transgender men?
For trans men, the outlook is quite excellent. They can freeze eggs, they can freeze embryos, and there also are experimental protocols about freezing ovarian tissue. But for trans men, there really seems to be really little impact of gender affirming hormone therapy on their reproductive outcomes. So once they stop testosterone after a washout period, nearly all trans men will resume ovulation and menstruation and respond really pretty normally to ovarian stimulation.
Okay, so it's good to hear that gender-affirming hormone therapy does not necessarily harm fertility, but there's still a reason to preserve fertility earlier in treatment, or even before gender-affirming hormone therapy.
So for trans men, it doesn't seem to make much difference how long they've been in transition. For trans women, there are limited data available, but generally speaking, the longer that they have been on gender-affirming hormone therapy, the poorer the semen parameters are going to be. And in some cases, and this is unusual, fortunately, but there can be atrophy of the testicle. But fortunately, that's rare. But, I would say that, patients that are on gender-affirming hormone therapy for, greater than, let's say, 2 or 3 years may have some permanent reduction in, the quality of their sperm and in the quantity of their sperm. But the thing is with assisted reproduction, like in vitro fertilization, we don't really need normal semen parameters to achieve success. So it's ultimately not really that relevant, really, for either trans men or trans women. But it's preferable to do it for a lot of reasons before the transition is initiated, because for a lot of reasons. Particularly the suspension of therapy, and then just to achieve optimal outcomes, to have the most eggs, the most sperm, and all of that.
Dr. Potter mentioned that with IVF, it's not as important to have normal semen parameters. And that's because with IVF, doctors can use a procedure called ICSI.
It's called intracytoplasmic sperm injection. So with intracytoplasmic sperm injection, we can take a single sperm and inject it into the egg, and we can achieve fertilization perhaps they have 25 eggs, which means the lab needs to find 25 normal sperm, which isn't hard to do. And even in the case of a very poor semen specimen, I mean, there are probably at least hundreds of thousands, if not low millions, of total number of sperm.
It appears that gender-affirming therapy doesn't necessarily mean that fertility treatment options will be impacted, but it's still sometimes recommended that people preserve fertility prior to these treatments, mostly so that therapy won't have to be interrupted later on down the road. So we asked Dr. Potter if, in his experience, this kind of information about the benefits of preserving fertility prior to gender-affirming therapy was often being discussed with members of the trans community prior to therapy.
Well, all the patients that I see obviously have been made aware that fertility preservation is available to them, or fertility treatment is available to them, which is why they are in our office. But in general, there is a movement to standardize educational materials and make them more widely available. And, I think they're doing a pretty good job. Historically, if you look at, data, the majority of trans men or trans women would freeze sperm if they were made aware of it prior to transitioning, because it's such a simple thing to do. I'm not aware of numbers of that sort for trans men, but it's something that patients should really be made aware of. And oncology is a great example. They really initiated a standardized education program and protocols where young women with breast cancer, or young people with different types of blood cancer, and they're common in those age groups, are now routinely made aware of the availability of fertility preservation and the consequences potentially of their treatment on their future fertility. And what we really want to do for all of our patients, including our transgender patients, is put them in the position to be informed patients and consumers, so they don't have regret later on. And the best way to do that is to make sure they're fully educated as to the options available to them, and that those options are made accessible to them.
Yes, education and information really is key here. And as we've heard today, the very first thing Dr. Potter said was that transgender people have all the same options as the cis community. So really, the biggest hurdle for this community isn't the assisted reproductive treatment options. It's something far more pervasive.
I think that one of the bigger issues that trans people have is that, as a group, they are one of the most misunderstood and discriminated against groups of human beings on this planet. And so, absolutely, there are trans people that have a difficult time finding a clinic that will treat them at all, depending on where they live. And then sometimes if they find a clinic that will treat them, are they being treated with the same dignity, respect, and empathy that they should be, that all of our patients should be getting? And I think that having a welcoming environment is really important when you're a trans person and you're looking for a clinic to help you with these issues. Fortunately, I don't know that there's any polling on this that I'm aware of, but it feels like, at least here in Southern California, that the majority of clinics would be welcome and open to treating these patients. But I can't really speak for the rest of the country.
Yes, I believe Dr. Potter is right when he says that, by and large, the fertility medicine community is highly supportive of transgender people. But it's worth noting that this is something to keep an eye out for. If you feel like the clinic you chose isn't respecting you, and frankly, this goes for everyone, well, then it's best to find another clinic. Okay, moving on to the next question. Can trans men carry a pregnancy?
Absolutely, trans men can carry a baby to term. It has happened. In fact, there are many spontaneous pregnancies that have occurred in trans men on gender-affirming hormone therapy. And so it's very important in that group to counsel them if they're engaging in sexual activity that might result in pregnancy, that they use contraception, potentially like a copper IUD or some non-hormonal modality. Pregnancy presents, certain risk, and, particularly if they've had top surgery and there's residual breast tissue that can hypertrophy, or if they have breast atrophy and have been binding, they may see their breasts start to grow, and that could be somewhat dysphoric for some patients. So, it just really depends on what the patient feels is right for them. If they're adequately counseled, hopefully it's not an unplanned pregnancy or a surprise that puts them in some sort of dilemma or crisis.
It's very clear that there are many family building options for those in the transgender community. And doctors like Dr. Potter have firsthand experience helping transgender people achieve their dreams of family. But there is one point that should be made when discussing these treatments and the impacts that hormone affirming therapy can have on people when it comes to fertility health. And that's the fact that science and medicine is driven by data. And the simple truth is that there just isn't a lot of data when it comes to these things. Not yet, anyway.
In this field, all of the conclusions and opinions that we have are based on relatively limited data. These are typically case studies and retrospective case studies. And, so the data isn't strong. And these are not common cases relative to other things in medicine. So it's going to take a while for us to accumulate meaningful data in this area. But, my hope is that there's systematic effort to, collect this data and analyze it as time goes on.
This is a Fertility 101 episode, so it's really designed to get a conversation started and give you a baseline of information. I hope it goes without saying that if you want to dive deeper into your specific health, wellness, and fertility options, then you really need to speak with your doctor. Whether transgender or cis, it really is the same when it comes to personalized medicine. Each of us are different and experiencing our own journeys with our own goals and in our own bodies. So we need to get answers that are appropriate and specific to each of us. And as helpful as I hope resources like this podcast and our YouTube channel are, there really is no replacement from the personal medical advice of your physician. And with that, I want to thank Dr. Potter for joining us today. And I also want to thank you for listening. If you want to connect with us, you can do so at Instagram at This Is Infertility Podcast. If you want to follow Progyny, you can do that at Progyny Inc. Of course, if you're listening on a podcast app, please leave a rating and a review. And watching on YouTube, please subscribe and like. This Is Infertility is brought to you by Progyny. And as I just said, the podcast is not intended to substitute for the personalized expert advice of your physician. I'm Dan Bulger, and this is Infertility.